Welcome to Microcurrent, the Future of Medicine. I believe in synchronicity, and last year on my birthday, the New York Times Magazine featured their entire edition on the body electric. It was all about the miracles of microcurrent, how microcurrent is going to revolutionize healthcare, how microcurrent is now going to treat chronic disease, treat diabetes, hormonal problems, vision problems. This was really exciting because finally the mainstream press is beginning to recognize microcurrent. Now, you should only use microcurrent under a doctor's supervision. Some of the machines out there have a very high level of current, which can cause damage to the body, and I'll talk about that a little later in the webinar. You have to be careful using microcurrent if you have a pacemaker, a seizure disorder, and also when you have a serious condition where surgery or other medical care will have a better outcome. Dr. James Oschman wrote a wonderful book called Energy Medicine, and he believes that our understanding of the pharmaceutical methodology, the way drug works, is really wrong. He feels that every drug has a certain frequency or vibration. So actually, if we can generate these frequencies or vibration, we might be able to do away with the entire pharmaceutical industry. Imagine having a frequency or current vibration that can treat high blood pressure or heart disease. It is here right now. These methods are available right now. Dr. Becker, who recently passed away, was a very prominent orthopedic surgeon. He wrote the book called The Body Electric, and he believed that microcurrent could work miracles in terms of regenerating bones. One of the biggest problems when you're an orthopedic surgeon, you want to get those bones to heal, and microcurrent can stimulate that activity. He did work with salamanders, amputating their limb and then applying current, and it accelerated the regeneration. And if he blocked the current, the regeneration would not occur. Simply put, microcurrent and electrons. Disease is a lack of electrons, so microcurrent is putting these electrons back into the body. You've heard that an alkaline pH is good for the body. That's a pH which is rich in electrons. An acidic pH is not good for our health. This is a deficiency in electrons. So the bottom line is electrons are lacking in any diseased tissue. So by putting these electrons back into the body, we can help treat the disease state. Now, I was introduced to microcurrent by Sam Snead, a great legendary golfer. This was in the late 80s. I read an article that Sam Snead had a miraculous cure of his macular degeneration using a method called microcurrent. I had never heard of it. I called up the company and got a couple of machines, and it worked. Roughly about 70 to 80% of my macular degeneration patients that I treated did have an improvement of vision. So I began using it in my practice. And of course, it's changed much since the 80s, and I'll talk more about that. Now, I had the pleasure of treating Sam Snead for a week. In return, he gave me golf lessons. And everybody knows after Sam watched me hit a couple of balls, he said, "Dr. Kondrot, just give up the game." Early on, I was mainly using microcurrent to treat eye problems. And then my son, Sean, broke a bone in his wrist. It's called the pisiform bone. And this bone doesn't have any circulation. And the doctors were going to do a major surgical procedure called an open reduction. But they wanted to put a temporary cast on to see if it would heal by itself. So while the cast was on, I hooked my son up to microcurrent. And within a week, the surgeons were shocked because the bone had completely healed. The top left is Lance Armstrong. In addition to his blood doping, his team routinely used microcurrent. Microcurrent just is amazing to rejuvenate the body. And on the right, two other athletes, my wife and myself. We ran the Marine Corps Marathon, and I was suffering. I wasn't in shape. I'm a little overweight. But just a 30-minute application of microcurrent dramatically eliminated my muscle pain and just gave me back gave me back my body. I was able to walk again. Last year, we did the 500-mile Camino de Santiago pilgrimage. This was a wonderful experience. We did this to raise awareness for alternative treatments of macular degeneration. And microcurrent played an important part. You know, we had to walk 15 to 20 miles every day over some tough terrain. And you can check out our blog on healingtheye.com/Camino. There's a great movie called The Way, starring Martin Sheen. And there's also a great book called Filled of Stars by Kevin Codd. But I have to warn you, if you read the book Filled of Stars, you are probably going to want to end up doing the Camino just like we did. And here's some photographs. It was just a wonderful experience through the countryside of Spain. Beautiful, beautiful area of Spain. The people are so friendly, and this trip really changed our life. And that microcurrent kept me going. Here I am applying it to my sore feet. Sometimes at night, I would just hold the electroconductive gloves and the current would go through my body to rejuvenate me. Now, this year, we're going to do the 435-mile Camino Le Puy. This is through the section through France, and we are going to do this to raise awareness for the alternative treatments of glaucoma. So you can visit our blog at kondrotcamino.com. We can use all the support we can get, so go to CaminoKondrot.com. Now, what is this frequency-specific microcurrent? Every tissue in the body has a unique frequency or vibration. If we match the resonance of the microcurrent with the tissue, we have a harmonizing effect. So if you have two C-sharp tuning forks and you vibrate them, they're going to harmonize. They're going to support each other. So we're trying to do that to the tissue. Send the right frequency, it matches the tissue, and you're going to get a harmonizing effect. Now, I recently got my ham operator's license, and that's my call letters, KM4JQR. And this helped me understand microcurrent, because if I'm trying to contact somebody a couple hundred miles away, I have to tune in the exact frequency that they're on. If I match their frequency, we are connected. Then what I do, I talk to them. So my voice is transmitting a message. That's what we do in microcurrent. We identify the frequency of the tissue, then we send a message for the tissue to perform some type of activity, either reducing inflammation, revitalization, etc. Now, this idea of treating the body with frequencies is not new. It goes back to 1863 when Albert Abrams, a doctor of osteopathic medicine, measured frequencies in the body with a device called the squeak box. And then he found that by putting these frequencies back in, there was a regeneration and a physiological change. There are many compendiums and books on frequencies. This is one, Radiotherapy and Electroacupuncture by Charles H. McWilliams. And this book has thousands of different frequencies, which each frequency does a certain physiological effect in the body. So modern frequency-specific microcurrent utilizes hundreds of frequencies within the range of 0.01 to 999 hertz with varying intensities. We don't like to go up above 600 microamps. A microamp is a millionth of an amp. And I'll explain later on why it's important not to go up higher, because if you go up higher, these high currents have shown to decrease cellular activity. So we have two channels. A is the pathology, B is the tissue. We communicate with the tissue, and then we send a treatment modality. So, for example, the retina has a frequency of 95 and the macula 137. We identify it, we resonate with it, and then we send a frequency in for the pathology to correct it. 18 is hemorrhage and edema is 14 if you want to use those frequencies. So these are some common channel A frequencies. Always I use 40 inflammation, chronic inflammation. That seems to be a component of every pathology in the body. Spasm, hemorrhage. 13 is scar tissue, which is a valuable frequency. And you can see we use 970, which is the emotional component. In Chinese medicine, we know that every organ in the body is related to an emotion. For example, the liver is the emotion of anger and frustration. The lung is grief, the kidney is fear. So we use that 970 no matter what tissue we're treating, and it seems to have produced a good effect. Here's some examples of channel B or tissue frequencies. The skin, which is a big one, 355 if you're doing facial rejuvenation, and muscle 46, ligaments 100. These are frequencies I used when I did the Camino, and there's the brain and the liver. So we combine these frequencies. First we determine the pathology frequency, and next we determine the tissue frequency, and we send it into the body. Now it's interesting, microcurrent can act as a diagnostic tool. What do I mean by that? Well, if you're not sure what's going on in the body, if you send a frequency of inflammation, and let's say it doesn't get better, it's the wrong frequency of the pathology. If you send a frequency of spasm and the pain goes away, then you know the pain is due to spasm. So it can be used as a diagnostic tool. Here's an example to show that, and this was a study done in Australia to show that combining these frequencies do have a profound effect. The blue there indicates swelling in a mouse's ear after the application of arachidonic acid, which is a powerful acid. It's about 11 microns of swelling. When you combine 40, which is inflammation, and 355 skin, you can see a dramatic reduction in red, almost reduced it by 2/3. But if you only use 40, which is inflammation, there is not as much as a reduction. Early on, we had mechanical machines where you had to dial in the numbers and you hit a timer and you had to run it. It was very, very tedious and time consuming. I felt that there had to be a way to automate it. I consulted with a couple of electrical engineering firms, and all they wanted was 30 to 40,000 to do a feasibility study, and they told me it was unlikely, that it could not be done. But I was persistent. I signed up for a master's program in electrical engineering at Arizona State University. And while I was there, I met this fellow by the name of Ning Wu, and I call him Ning Wow. Ning Wu is a third-generation electrical engineer. His father is professor of electrical engineering at Beijing. In a matter of 6 months, Ning and I worked together and we developed the first programmable machine. So this machine now could take all these frequency combinations and put it in a simple device. So you don't need to apply each individual frequency pair. They're all loaded in the machine and they can be played back as you need it. So this is a picture of the machine, and it's hooked up to a regular laptop computer, which you write the frequencies. And we use silver impregnated gloves with silk that's impregnated with silver. And this has a very high conduction, and it's much more simpler to use than the EKG pads with sticky paste and all that. So this is something that we found to have a very, very easy delivery system. These are some of our general protocols that we're using. I mean, you name the problem, we probably have a protocol for it. You can see adrenal support, asthma, back pain, cystitis, tooth pain, facial rejuvenation, hip pain, gastritis, lung problems, skin problems, neuropathy, on and on and on. So these protocols are easy. You load them in the machine and you could run it to treat the particular condition. Here's an example of us treating an eye patient, running the current through the eyes to the back of the head. And here's an example of doing stress or detox, just simply holding the gloves in your hand. And here's an example of doing the stress and detox over the abdomen, because we know the organs of detox are located there, the kidneys and liver. And also when you do stress over the abdomen, the solar plexus is there, and you seem to get a much better effect. Treating an elbow, we simply wrap the silk glove in a washcloth. We put one at the top and one at the bottom so the current will run through the area of discomfort. And of course, one of my favorite ways is putting the microcurrent in a hot tub. And I know your mother told you never put electrical equipment in the bathtub. but we're running this really nice frequency in, which resonates in the water, then resonates into your body to help. Now, it gets really exciting because right now researchers are patenting some of these signals. I've been talking about these signals now for over 10 years, but now doctors are patenting them. Here's one by Cano, which was recently patented, causing muscle tissue to release vascular endothelial growth factor, which causes new blood vessels to grow, which is important for regeneration. Another one, number 2, is releasing SDF-1, a stem cell homing signal. So in other words, it signals the stem cells that come to that area to regenerate. Another one is to cause a proliferation of stem cells. One is to help treat heart scar tissue to beat in a much better way to eliminate arrhythmias. And another one to greatly accelerate healing of wounds and scars. So you can see that now industry is beginning to patent these signals and developing devices. This is a device that was recently developed called the MyoStim to treat patients after open heart surgery, heart transplants, or after cardiac injury. It helps regenerate the heart. And this is now commercially available when hospitals are buying them. Microcurrent works extremely well for diabetic foot ulceration. It can help prevent amputations. And you can see down below, they've developed a electro mesh silver sock, which delivers the current to the feet. Also, it's used for treating limb ischemia, or lack of circulation in the legs, either due to diabetes or arteriosclerotic disease or injury. Amazing, amazing. And you're not going to believe it. There's a device called BRACELL, where a woman will wear this as a bra. A current will help increase the breast size. I've seen everything. Number 1 use of microcurrent is for facelifts and a natural way of improving circulation, improving vitality to skin, and reversing those years of aging. And of course, that's what we're doing to the eye. We're reversing years of aging to the eye. We're reversing macular degeneration, or we're reversing glaucoma. And you can lose abdominal fat by applying microcurrent to the abdominal area and running a current through. The same investor that has brought microcurrent to the market has approached me to take my microcurrent machine public. And we've set up a company called ISCHEMIA. And we're developing a prototype that we can take to the general market. I've studied and looked over my data over the last 2 years, and I've submitted a publication of over 290 eyes treated using microcurrent, and this has been accepted for publication in Alternative Therapies in Health and Medicine. And this is a brief summary of the results. Over 90% of patients have had a significant improvement of vision. And some, well over half, have had 1 line or better. And these are conditions where the eye doctor said nothing can be done. Nothing can improve your vision. So microcurrent can rejuvenate lost vision. Here is a patient with the use of microcurrent for glaucoma and uveitis.
I'm Dr. Carol Benoit, neurologist, and I have just seen Dr. Edward Kondrot for the first time for devastating eye problems that have really put me under for the last month, especially rapidly worsening eye inflammation and tearing. My basic problem is glaucoma due to autoimmune eye disease called uveitis. And in the hands of 4 conventional ophthalmologists, of course, nothing gets better. I just add eye drops, which I'm rabidly allergic to at this point, and eye visits and costs. And he has significantly reduced the size of a blind spot in my left eye. I am just so thrilled about that. He's improved my visual acuity significantly, 3 lines on the eye chart. My contrast sensitivity is markedly improved. and my comfort level is markedly improved. Every treatment seems to bring greater improvement for me. I've been most impressed with the reduction in my allergic symptoms with the cold laser, but everything helps. I love the microcurrent machine. It gets me more relaxed than anything that I have gone through. But basically, to see the improvement that I have just learned about today after this, my third day of treatment, is astonishing, with hope for further improvement in the future. God bless him. Thank God for bringing me here. Thank you.
This is an example of microcurrent used to treat transient ischemic attack, which is a small stroke. And it's really interesting because this gentleman had frequent episodes of TAA and he aborted it using microcurrent. And also he was using it to treat his cervical pain that was not refractory to typical therapies.
Right. Well, the last series of TIAs, I went to program 4 on the microcurrent machine, and that seemed to have prevented more than one. And this happened twice.
So it wasn't a fluke. If it happened twice, then
it happened twice.
Yeah.
And as regards cervical arthritis in the inflammation program, it relieved pain in a matter of minutes.
When the traction didn't help, right?
When traction didn't work.
This is an example of microcurrent with stress reduction. And this patient is me. You can see my mental stress is off the top. There's an imbalance in my sympathetic and parasympathetic system. And after a 20-minute microcurrent treatment, it went from this, you can see the mental stress off the chart, to this, mental stress normal. So, it's one thing when you kind of feel good after microcurrent, but when you get some type of feedback on this measuring device, which is a heart rate variability monitor, it really is exciting that, microcurrent can have this profound effect. This is an example of microcurrent treating TMJ, temporomandibular joint syndrome, which is really painful and sometimes difficult to treat, and also brain fog in a patient.
Hi, I'm Dr. Ada Ortiz Santiago. I'm a pediatrician, board certified. I'm also a naturopath, an acupuncturist, and a homeopath. I came here to see how the machine works in Spa, and it's wonderful. I suffer from a chronic MJ, and I have the neck problems and the tinnitus and everything. And also, I was forgetting things because I was so tired. I work in a hospital. And after 3 minutes of having it on here for the TMJ, and I put it in my brain, I remembered things I couldn't remember about 20 minutes ago. I kept remembering what's the name, and look at my mouth. I can finally open my mouth, which is usually cannot be done because the TMJ makes your temporomandibular joint inflamed. So I recommend highly this product for everybody. Thank you.
So what can microcurrent do? It improves blood flow, stimulates cellular activity, removes scar tissue, reduces inflammation, neuroprotective effect. And if you really think about it, doing these things, microcurrent should help just about any disease process. This is a landmark study done by the Korean investigator Chang, published in the Clinical Orthopedic and Related Research. He studied the effect of microcurrent on the cellular level, and he found that currents between 50 and 500 microamps will cause an increase in mitochondrial activity and an increase of 300 to 500% in ATP levels. ATP is like the gasoline of the cell. My goodness, 300 to 500%. This would have been a good study if there was a 10 or 20% increase. But it's also interesting that in this study, he found that if you go above 500 microamps, it may decrease the cellular activity. So you have to be careful in the type of microcurrent machine you buy. A lot of the machines generate a high current, like the TENS machines. They may be good for blocking pain, but not good for regeneration. I was known as the doctor with the magic box on the Camino de Santiago, and I treated hundreds of pilgrims walking the 500 miles with me. And this is an example of a gentleman I treated who was skeptical of the treatment.
Because I thought this was voodoo medicine. I thought it won't help me anything.
Because you're a big guy.
But it does.
Right? Like 60-ish%?
60?
Come on, let's get on.
Microcurrent also balances the autonomic nervous system, treats neuropathies, can treat depression, detoxifies the body, and as I mentioned, stimulates stem cells. All these things are just amazing. Can lower intraocular pressure in some cases, reverse macular degeneration, facial rejuvenation, corrects musculoskeletal problems. Hi, this is Dr. Edward Kondrot, America's favorite eye doctor. And you know, it's my mission to help you reverse vision loss. It's very, very important to me. And there are many modalities that you can use to reverse vision loss. But my favorite and most effective is microcurrent. It's a fantastic procedure. And I want all of you who have lost their vision to begin using microcurrent. I have an amazing offer, a special offer that I hope you take advantage of. The end of this month, we're having a 2-day training program. And I'm throwing in a special bonus. When you sign up for this 2-day training program, you'll get a ticket for the Microcurrent, our 10th annual Microcurrent conference, a 3-day event that is phenomenal. The value of this is $695, and it's my gift to you when you sign up for the 2-day training program. So get started on Microcurrent, restore your lost vision, and I'll see you there.